Mr. Abubakar Kende, Secretary General, Nigerian Red Cross Society, says the organization has placed on alert nearly 1 million of its volunteers across the country in view of the global outbreak of coronavirus. Kende, who said this at a news conference in Abuja, urged Nigerians to imbibe good hygiene and observe measures recommended by the Federal Ministry of Health.
We have placed an alert to over 1 million of our volunteers. We have been about 1 million volunteers across Nigeria, and we have sent alerts actually to all of them to be prepared. From what we are seeing happening in China, we want to leave nothing no stone untouched to ensure that people are fully prepared and ready. So I have mobilized about 100,000 volunteers in these 23 states to support the cause of this kind of intervention. Not only in the 26 states, but also the neighboring state that may also have potentials of being infected or spreading these diseases to these states. And the key issue is actually about hygiene promotion through mass media, churches, mosques, schools, markets, and communities, and to conduct also active surveillance, what we call active case finding, so that if people have been found with symptoms of these things, they are quickly referred to health facilities that have been designated to treat these cases.
The official called on relevant government agencies and corporate organizations to partner with the Nigerian Red Cross Society to assist in the fight against Lassa fever and prevention of coronavirus.
We want to call all relevant agencies, government agencies, corporate organizations, individuals, and groups also, to see how we can really partner with Nigerian Red Cross Society to assist in fight against Lassa fever and the prevention of this coronavirus. There is no better time to rise to the needs of Nigerians than now, as the wise people say prevention is usually better than cure. We work closely with the media, radio, television, and of course the print media also, to see how we can further sensitize the general population on this situation.
In a separate interview, the National Health Coordinator Joy Ibanga and Head of Communication and Advocacy, Mr. Nwakpa of the Nigerian Red Cross Society, have admonished the public to observe and practice personal hygiene methods to prevent and contain the spread of the Lassa fever virus.
Be vigilant. If you notice any symptoms of Lassa fever, like fever, bleeding, face edema, please go to the hospital. Early detection is key.
We advise people to observe optimal hygiene practices at home. Keep your environment clean. Most especially, wash your hand always with water, not just washing your hand with ordinary water. With water, wash your hands always with water and soap as many times as possible. Not just when you want to eat, but when you want to eat, when you want to cook, when you go to toilet, when you want to change your baby's diapers. After changing your baby's diapers, wash your hand as often as is possible. This is